This conference will now be recorded.
Hello? Hello?
Good afternoon and welcome to HAFA's Education Thursday. We are very excited about this topic. If you've talked to me, then you know that I talk about all the time leaving money on the table and how important it is for us to look outside of what we normally do for extra funds. Today, we're going to have a Miss Cindy Osborne, who has been a very dear friend for many, many years, who is now representing Seniors Advisory Services, one of HAFA's partners, present the ABCDs of Medicare. So I'm going to put myself on mute and turn it over to Cindy. Cindy, you have the floor. Thank you so much.
Thank you, Ronell. Have a great afternoon, and thank you for the introduction. I thought to start, we would just kind of a little housekeeping. If you have any questions, if you would use the chat function, and before we get started, maybe we could test that chat function, and you could tell me where it is that you are listening from, so that I'll know where my callers are. Oh, I see Ronell, Baton Rouge. And if you could use the chat function and just send it to me as the organizer, not the entire entire audience. So just go ahead and moving forward, I want to tell you a little bit about me. I'm not new to the insurance agent industry. I have 29 years of life and health insurance experience. I have served as president of our New Orleans Association of Health Underwriters, and I've also served as president of the Louisiana Association of Health Underwriters in 2005. Not really new to Medicare either. I was a sales manager of People's Health for 8 years. People's Health is a Louisiana-based Medicare Advantage plan. And then after I retired from People's, I sold Medicare Advantage through Senior Advisory Services since 2011. A little bit about the presentation. I feel that Medicare options are extremely important to your clients as they reach Medicare eligibility, or when they actually retire from employer coverage, since people are working a little bit longer these days. And they need options, and you should be able to give them the options. And if you can't give them the options, then someone else will. A little bit about Medicare Advantage in Louisiana. All of our carriers are expanding big time, and we have had little or no competition in the middle or north of the state, and all of that is really changing. So in Louisiana, Medicare beneficiaries are going to have many more options than they've ever had before. So with that, let's go ahead and get started. We are going to talk about the basics of Medicare, things to consider, next steps, and then questions and answers at the end, or if someone has a question during the presentation, feel free to ask that question. So some Medicare milestones. A lot has changed since Medicare was implemented. As many of you may know, it was implemented in 1965 by President Lyndon Johnson. He signed Medicare into law. And former President Truman, who had been trying to get some type of Medicare plan passed for almost 2 decades, was the first person to be issued a Medicare card. The first major change in Medicare was in 1972 when Nixon signed into law the Medicare eligibility was extended to people that have disabilities and to people with end-stage renal disease. Now, people with disabilities usually have to wait 24 months to get their coverage for Medicare, but individuals with ESRD or end-stage renal disease can get coverage as early as 3 months after they begin their regular dialysis treatment. And beneficiaries that have been diagnosed with ALS or Lou Gehrig's disease don't have a waiting period at all. They start receiving Medicare benefits as soon as they start receiving Social Security disability income. Now, in the 80s, Medicare expanded home health services, and they added hospice services to the list of Medicare-covered services. And also in the 80s, Medigap, or Medicare Supplement Insurance, was brought under federal oversight. Next change was really in 1997, and that's when the Medicare Plus Choice program was enacted. That Medicare Plus choice program is now what is known as Medicare Advantage. Moving forward to 2003, President Bush signed into law the Medicare Modernization Act, and that made lots of changes. It brought about some Medicare marketing guidelines and some rules and do's or don'ts as to what producers can and cannot do with marketing to beneficiaries. It created the annual enrollment period before 2006, and actually it started in 2006, signed into law in 2003, but implemented in 2006. Before this annual enrollment period in 2006, a beneficiary could actually change Medicare plans as often as they wanted to. And now they were limited to a period of time that they could enroll into a plan or change plans. And then it also began the voluntary Part D, the outpatient prescription drug benefit, which is available through private drug plans and Medicare Advantage plans. And I say voluntary because that's what Medicare says. It's voluntary, but we'll talk a little bit more about how I don't feel it is voluntary. So the basics, just who is eligible. You're eligible for Medicare A and B if you're 65 or under 65 and on Social Security disability for 24 months or having ALS or ESRD. And you must be a U.S. citizen or a legal resident who has lived in the United States for at least 5 years. Now, there are several enrollment periods. There's the initial enrollment period for Medicare, and that is a 7-month window. It begins 3 months and ends 3 months. 3 months before and ends 3 months after the month of your 65th birthday. So if you were to, enroll in Medicare 3 months before your birthday month, your effective date would be the first of your birthday month. Now, if you or your spouse continue to work and have employer coverage, you can, of course, delay enrolling in Medicare. You must have creditable prescription D or prescription D type benefits, prescription benefits, or you could be subject to a late enrollment penalty, which we'll talk a little bit more about. Then there's the general enrollment period. That is for people that did not enroll during their initial period, for people that dropped Part B either voluntarily because they moved out of the country for a year or two, or involuntarily because they were incarcerated. And so they would have the opportunity to get their Part B back. They would enroll between January 1st and March 31st, and they would have their coverage begin July 1st. Now, everyone that does not, have a Part B or does not have creditable employer coverage could be subject to a 10% penalty for every year they did not have Part B. Now, VA coverage is not considered creditable Part B coverage. Then you have your special enrollment period, and that allows an individual who qualifies to enroll in Medicare at a later date with no penalty or waiting period. To qualify for that special enrollment, they must have been actively or their spouse actively working and had continuous employer coverage. They would then have to enroll in Medicare within 8 months of the employment or the coverage ending, whichever happens first. So here's our ABC soup, A, B, C, and D. A is hospital, B is medical, and A and B are part of original Medicare provided by the government and signed up through Social Security. Part C is your Medicare Advantage, and Part D is your outpatient prescription drug coverage, and those are sold by private companies. So Part A is going to cover your hospitalization, hospice care, a few other things. It's typically a premium-free benefit because people pay a little bit out of their paycheck through their working years. The original Part A has an annual deductible, which changes pretty much every year. Right now, it's $1,340. And then it's an 80-20 coinsurance. And of course, with Part A, there is no yearly limit. So there's no out-of-pocket limit for a person that only has original Part A. Part B is something that people elect if they don't have employer coverage. They can elect or they can decline. There is a standard monthly premium of $134 right now. However, high earners could pay quite a bit more. And if you don't sign up for Part B when you're first eligible, as is you don't have credible coverage from your employer, you may have to pay a late enrollment penalty. Now, VA is not considered credible Part B coverage or medical coverage. And then you have Part C, also known as Medicare Advantage. And Part C is basically a network of doctors, hospitals, and pharmacies that gives a beneficiary, predictable costs. They have set copays for all of their services, and they do have an annual maximum out of pocket of $6,700. So it's predictable costs for the beneficiary. You purchase it from a private company. You have to continue to pay your Part B, and prescription drugs may be included with the MA plan, and it would be known as an MAPD, Medicare Advantage Prescription Drug Plan. And Medicare Advantage, most of them cover additional services like wellness programs, routine hearing and vision, fitness memberships. And, the plan is paid based upon the beneficiaries that are enrolled. So the Medicare Advantage plan wants to keep that beneficiary, as healthy as they can to minimize their outpouring costs so that they can be profitable. Then you have Part D, which is outpatient prescription, drug coverage. It is made up of formularies and tiers, and it's purchased from private companies. It typically does have a monthly premium that has very, very incrementally increased over the years. It's optional. They say it's optional, but if you don't enroll, you could have a late enrollment period of 1% every month that you were eligible for Part D and did not have credible Part D coverage. You can usually get Part D of two ways, as a standalone or as part of a Medicare Advantage plan. And by the way, VA coverage is considered creditable coverage for Part D. So what a lot of people do, they make a choice to supplement their Medicare, original A and B. They could buy a supplement, which or Medigap plan, which kind of helps the deductibles go away and allows them some additional benefits that they wouldn't have necessarily with original Medicare and Part A and B. It is purchased from a private company. It has a monthly premium, and the beneficiary has to continue to pay their Part B. Now, if they purchase a supplement, it works only with the Medicare Advantage plan, only with original Medicare. It does not work with a Medicare Advantage plan, because with a Medicare Advantage plan, Medicare pays the plan to take care of the claims. Medicare doesn't pay the claims anymore. So that's why it doesn't work with Medicare Advantage. So enrolling into Part C or Part D, there's an initial enrollment period when people first become eligible. Then there's the annual election period, which I mentioned earlier was enacted as part of the Medicare Modernization Act. And initially, the annual enrollment period was November the 15th to December the 31st, with coverage beginning the first of the year. It has now been changed. Medicare, good change, changed it from October the 15th to December the 7th. That way, it allows a beneficiary who wants to enroll in a Medicare plan time to get used to the rules and regulations of that plan, get their ID card, get to know their primary care doctor if they've chosen a new doctor. The annual enrollment period is also the time when a person can purchase a different plan and or cancel the coverage that they have, and everything takes effect on January 1st. And then there's a special enrollment period, and this would allow a beneficiary to purchase outside of the annual enrollment period If he or she were to move into the service area, they would be allowed. If they have some income changes, like for Medicaid or low-income subsidy people, if they had some type of a chronic care issue that came up, and it would allow them to join a special needs plan. If a plan in their area were to terminate, it would allow them to change plans. And then there's also the ability to change plans if you are changed or in a 5-star plan or moving to a 5-star plan. Now, in Louisiana, we don't have any 5-star plans. I'm honestly not sure about the rest of the country, but there's none in Louisiana. People's Health is the only 4.5-star plan. The rest of the plans are less than 4.5. So the things to consider, you need to know your clients. You need to know, are the spouse, he or she going to continue to work? If they have employer coverage, is retiree coverage even available? How's their health? Do they take a lot of prescription drugs? You may want to check formularies of different plans, Part D plans or even Medicare Advantage plans. Do they travel? Because original Medicare doesn't cover you outside of the country, whereas most Advantage plans and some Medicare supplement plans does have coverage outside. And, depending on their financial situation, they may have some additional help that is available to them. So if they want to choose a single plan, a Medicare Advantage plan, Part C, it's going to give them A and B. It's going to give them additional benefits, which we talked about earlier, and most plans do cover prescription drug plans. Or they may want to just keep original Medicare and get a Medicare, supplement or not. That does, create some exposure to just keeping original Medicare. But if they kept original Medicare, they would use that Medicare card to access their care. If they join a Medicare Advantage plan, obviously they'll use the Medicare Advantage plan. Now, if any of you have ever seen a Medicare card, you would know that until this year, the Medicare number was your Social Security number and then a letter or series of letters following your Social Security number, and it shows your effective date of Part A and Part B. The Medicare plan cards have changed to stop identity theft. It will have Medicare beneficiary identifiers, so it'll have 4 digits, 3 digits, 4 digits. It'll still have the A and B dates. And April of this year was when those new cards started being distributed. And all Medicare cards that people have now will be getting their new cards by April of 2019, and they will be asked to just destroy the current card that they have. So, understanding the options. It is a very important service to your client and commissions to you, whether you go the Medicare Advantage route or the Medicare Supplement route. Because as I mentioned earlier, in the absence of a Medicare Advantage or supplement plan, your client has significant medical bills if they have a major health event. And then, of course, if you're not offering Medicare options to your clients, someone else is going to be offering those Medicare Advantage options or Medicare supplement options. So just to tell you a little bit about Senior Advisory Services, we have been, a very leading producer of Medicare Advantage plans in Louisiana. We do help to train, identify, contact, and sell Medicare plans to potential clients, making sure that you're doing it, within compliance. We help guide you through the certification process, which, is a little bit harder the first year you get into it. And then, of course, after that, you have 2 hours to collect renewals for the whole year. So it's, 2 hours well spent. No one knows the market like, the market in Louisiana better than Senior Advisory Services. And Senior Advisory Services is owned by Group Insurance, which is a trusted marketing partner since 1971. So with that, annual enrollment is only 81 days away. I'm actually going to be holding meetings throughout, Louisiana kickoff meetings, because there, as I mentioned earlier, there are a lot of movement of Medicare Advantage carriers into the different markets. And then you'll have, as you can see, you have my email address and my phone number. And questions? Does anyone have any questions? Okay, well, I look forward to hearing from you. If you don't have any questions right now and one pops into your mind later, do not hesitate to contact me. And if I don't know the answer immediately, I will get the answer and get back to you. So we didn't take a whole hour. Everyone have a great afternoon, and I look forward to meeting you guys in the future. Thank you.
Thank you for joining the call, and we look forward to working with you very soon.